Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm joined by our deputy editor, Nick Bostock, to talk about some of the latest news affecting general practice. Coming up on the podcast today, we're talking about the fallout from the budget, in particular what the increase in employers' national insurance contributions will mean for GP practices, including looking at the results from our own survey on this issue. We're looking ahead to next week's England Local Medical Committee conference and some of the topics that are up for debate and what they tell us about some of the key concerns facing the profession. And we're discussing salaried GP pay after warnings that the GP job crisis is driving down the rates doctors are being offered for GP jobs. Our good news story is about ONS survey data that suggests patient satisfaction with general practice is rising rapidly. That's all to come on this episode of Talking General Practice. First up, the fallout from the budget a couple of weeks ago is still reverberating around general practice. We spoke about the budget on the last news podcast just after it had happened and highlighted some real concerns about the impact the 1.2 percentage point increase in employers' national insurance would have on practices. So if you remember, employer contributions are set to rise from 13.8% to 15% from April next year, and the threshold of a salary at which they become payable will drop from £9,100 to £5,000. The changes come into effect from April, and in addition to that, the national minimum wage is also set for another significant increase from April. So Nick, we've been writing about this a lot over the last couple of weeks, and there is some very big concerns from GPs about the impact this is going to have, isn't there? I mean, Berkshire, Buckinghamshire and Oxfordshire LMCs have done some analysis on the financial impact this will have on practices. What did they find?
This is one organisation that works across these three counties, Berkshire, Buckinghamshire and Oxfordshire LMCs, often helpfully abbreviated to BBO LMCs. And like GP organisations across the country at the moment, they're hugely worried about the impact of the changes announced in the government's autumn budget. So they polled members to find out more about just how much it was going to cost them. And they got responses from just under half of member practices across the area, so 108 practices in total, covering nearly 1.5 million patients. And across those practices, the average extra cost per practice came to about £47,000 a year. So that's the scale of the hit practices are facing from next April from the changes to employer national insurance contributions and the rise in the minimum wage combined. At a national level, BBO says this means a loss of something like £260 million from general practice. So we're talking about more than £250 million being stripped out of practice funding as things stand. To add a bit of context, part of how we looked at this for GP Online was to think about what it means for the GP contract uplift practices received this year in 2024-25. You know, we've spoken about this on the podcast before, but to recap, about a month after the general election, the government announced a 7.4% uplift to core funding for GP practices in England. And that uplift increased the amount of funding practices received per weighted patient by £7.77 compared with funding in the previous financial year. And BBO LMCs says that the loss to an average practice from the budget changes works out at £3.64 per patient. So that means the budget will effectively wipe out nearly half of the gain from this year's contract. The LMC's analysis also highlights extra costs for PCNs that could come from the budget. It says the changes could cost the average PCN around £18,500. So that's an extra 47p a patient. And if you add it together with the loss per practice, it comes to more than £4 a patient. This PCN element is to do with costs for staff employed through PCNs, including the 30,000 plus staff in roles that have been created through the Additional Roles Reimbursement Scheme. And coming back to the contract, even though this year's GP contract uplift was far higher than anything the profession's seen in recent years, it was still far short of what the BMA was asking for. And it left GP funding in real terms about £350 million below the level it was at 5 years ago, according to the BMA. So a loss on this level, which reverses a big part of the funding boost from this year's GP contract, would be hugely damaging. Some of the language BBO uses to describe the impact the budget could have is pretty apocalyptic. It talks about it being existentially catastrophic and potentially the final nail in the coffin for general practice. So GPs desperately need some reassurance urgently and some sort of promise from the government that they will be given support with these additional costs. And that's what organisations from LMCs, the RCGP and the BMA have been calling for, but so far it hasn't been forthcoming. And in the meantime, BBO LMCs is saying that GP practice should step up collective action, basically taking all the steps they can to control workload, stop providing unfunded work and so on. And it also wants the BMA GP committee nationally to expand and extend collective action. So there's a sense that the response from GP practices now needs to really ramp up to make clear to the government just how big an issue this is.
That LMC survey also found some quite worrying conclusions about what this will mean for practices in reality, didn't it?
The point is that cuts on that scale, we've already had warnings along these lines from other organisations, whether it's the BMA GP committee nationally or from the RCGP, I think. But there are warnings that GP practices could have to close if they face cuts on this sort of level. There are certainly warnings that GP practices could have to reduce the services they offer or potentially the staff that they employ. So those are the sorts of impacts that, are clearly going to have an impact on patient services.
We actually carried out our own survey on this, which we've been running over the past couple of weeks, which found some very similar results to that. So that survey covered 477 GPs and practice managers. Most of those were GPs. And of those, 76% thought that the budget would have a negative impact on general practice. When you look at just GP partners, so that's 155 GP partners who responded to our poll, 91% of them thought it would have a negative impact on general practice. And of those partners, 77% said their practice was going to have to consider reducing staff, 65% said their practice would have to consider cutting services, and rather worrying, 11% said their practice would have to consider closing if the government doesn't actually provide any additional financial support to cover the extra costs the rise in employer national insurance contributions are going to bring. A number of partners also said that they would have to bear the brunt of these extra costs personally and cut their earnings again next year. Some of the comments we received to that survey, one practice said it would cost them £100,000 a year because they have a lot of staff due to running several branch sites. Another GP said that unless there was a significant increase in core funding, and they were suggesting a level of around 30% increase, general practice as a whole was really just no longer a viable business. Many of the responses actually, they recognise the need to raise taxes to improve public services and to improve the NHS, but GPs were really saying they needed some reassurance sooner rather than later from the government that practices would get money to cover these extra costs. Otherwise, there's obviously going to be some big impact for patients. Also, some real unhappiness in there. I think this is an important point to make. Some real unhappiness in there about the fact that consultants have received a pretty decent pay rise this year, while general practice got just 6%, as you were explaining earlier, Nick. And as we talked about on the podcast before, that funding uplift that practice has received this year for the 6% pay rise for staff and partners was already very unlikely to give GP partners a pay rise anywhere near that level. And, this all comes after years of falling income for partners, which our survey suggests is likely to fall again this year if there's no protection against this NI increase. And it's all a bit ironic, isn't it? Because the government says it wants to move from hospital to community. That's one of its big aims. But this all suggests it doesn't really value the contribution of GPs in the same way as it does consultants. And that sentiment really did come across from the GP partners responding to our survey.
It's probably worth mentioning here that you're only mentioning the polite responses to the survey. So there are plenty in there that weren't so polite, which really demonstrate just how angry people are, I think.
Yeah, really angry. There was quite a lot of swearing on some of the responses, to be fair. Just one other thing I think it's also worth mentioning here is we haven't really talked about that much so far, is the minimum wage increase. This is also a really big problem potentially for practices, albeit not as serious as the national insurance issue. I mentioned this on the last podcast, so that's due to rise by 6% for workers aged over 21 from April, and it comes after 2 years of rises that were around 10%. Obviously, it's a good thing that it's gone up in terms of ensuring people receive a decent wage, but the last two increases were not covered in GP funding, increases to GP funding, and it seems unlikely this one will be either. Other employers obviously can put up prices to cover this rise and also the national insurance increase, but practices can't do that. That's something that GP partners really made clear on our survey. And the reason the minimum wage increase is such a big deal is that as practices increase wages for those on the lowest salary in their business, often this means they have to increase salaries of other staff in the near vicinity of that range to ensure there's a differentiation between the roles. And some of the GP partners responding to our survey suggested they were going to have some real problems around this, and it was going to cost them quite a lot more than you might initially think unless they received extra funding to cover some of these costs. So, Nick, we've mentioned the impact this will have on patient services. We've touched on that there. The Liberal Democrats also did some analysis this week about what it all means in terms of the services patients can receive. What did they find?
The Liberal Democrats have put out quite a few press releases since the budget, hammering issues around the impact it's going to have, not just on GP practices, but also on other organisations such as care homes and hospices that look likely to be affected too. But this particular analysis suggested that the employer national insurance rise in the budget could cost the equivalent of more than 2 million GP appointments across England. So this analysis is based on an estimate from the Institute of General Practice Management, the IGPM, which said that an average practice could face a bill of around £20,000 just from the national insurance increase. So there are about 6,250 GP practices in England. So the Lib Dems estimated that the total cost of extra national insurance costs comes to about £125 million a year across the country. And they then divided that by the cost of a GP appointment. And the estimate they used put that at £56. And that came to 2.2 million GP appointments a year. So it's possibly a slightly odd way of looking at the figures because GPs aren't actually paid per consultation as such. But it's helpful in the sense that it highlights the scale of the problem. And again, it's probably quite an effective way of translating it into something that makes sense for the general public and maybe for politicians too. And ultimately, the Lib Dems message is one that is absolutely in line with what GPs themselves have been saying. They said that clobbering GP practices with higher taxes makes no sense at a time when people are already struggling to get GP appointments. And they said that the Chancellor should immediately exempt practices from the extra charges. And just as GPs have been saying, they said that if practices aren't supported to cover these costs, they'll have no choice but to cut services or staff, which you've already touched on.
Is there any sign that the government is listening? Do we think there's going to be some sort of assistance for practices forthcoming?
It still seems quite likely the government will offer some support to practices to cover these extra costs, but it's not really based on anything much other than a sense that it just makes absolutely no sense to hit practices with extra costs on this kind of scale. BBO LMCs said in their analysis that the government's election manifesto promised to increase GP numbers, improve quality of access, incentivise continuity of patient care and bring back the family doctor. Clearly, halving the benefit of this year's contract uplift won't do that. They also point out that GP practices basically get all their funding from the state. Although they're independent contractors, they aren't anything like standard private businesses. They can't increase prices to cover increased costs, for example, and they get essentially all their funding from the government for providing NHS services. Wes Streeting told Parliament recently that he recognised the pressure on general practice, and he said that he would listen to representations from the profession. He said that funding allocations for the year ahead haven't been made yet. So if you're a glass half full type of person, there's probably a grain of hope in there, I think. But there's a sense too that the government doesn't really understand what the budget means for GPs, and statements from ministers have been really confusing on this point. The Chief Secretary to the Treasury said shortly after the budget was announced that GP practices were not part of the public sector and would have to pay the extra employer national insurance contributions because of that. But he then also suggested that they'd be protected by a relief mechanism that's meant to make sure that small businesses won't be hit too hard by the extra costs. But as things stand, GP practices are not eligible for that relief precisely because they are public sector organisations. And they're defined as such in various bits of legislation, as GPs have been pointing out over the last week or two. And just this week, a line I got from the Department of Health press office said the government's approach to national insurance exemption did not include support for the private sector. And it said in that same line that GPs generally operate as independent businesses. So if there is support coming from GPs, the government's doing a pretty good job of hiding it at the moment. The BMA has raised all this confusion over practices' status as part of the public sector in a letter to the government this week. Once again, it's called for clear assurances that practices will be supported. But as I said, as yet there's been no real attempt from the government to offer practices any assurance. And that means uncertainty for GPs as things stand.
We mentioned there about maybe practices being exempt from this increase. And obviously the other option could be, extra funding going into practices to cover the cost of it. But if support or assistance comes through extra money being put into GP funding, then this is going to be really problematic, isn't it? As we've seen with uplifts in recent years to cover pay rises.
I spoke to a specialist accountant about this, Andy Powell, who's a board member at the Association of Independent Specialist Medical Accountants, AISMA. And he told me last week that even if the government decides in the end that it will offer practices support to cover the extra costs that arise from the budget, and for the record, he thinks they will in the end in some way, it would be near impossible to come up with a fair solution that would avoid winners and losers across general practice. And this is basically because GP practices are not in any way uniform. Their staffing is really different from one to the next. And that means that the employer national insurance costs could have a really different impact from one practice to the next. Practices with larger numbers of part-time employees, for example, could be hit harder. If a practice has a large number of employees who work part-time and are close to the current threshold for national insurance, the lower threshold that kicks in from April could suddenly bring a whole load of additional staff into the scope of national insurance contributions. So basically any solution that involved a uniform uplift to core practice funding, for example, delivered through global sum payments to practices, it might meet costs for some practices, but it might fall short for others. Another factor is that many practices earn a significant proportion of their income, it's more than the QOF these days, from locally commissioned services or local enhanced services. And income from these services funds staff that are involved in delivering them. So things like blood testing or spirometry, for example. But a global sum uplift wouldn't change the funding practices receive for those locally commissioned services. So practices would lose out when it comes to the amount of funding they receive to employ those staff. And that means that basically, for exactly the same reasons, some GP practices have benefited more than others from contract uplifts intended to deliver staff pay increases in recent years. Solving this extra cost from national insurance, even if the government decides that is what it wants to do, is not going to be easy.
There's a lot of anger about this, as we've talked about. It's the England Local Medical Committees Conference next Friday, where GPs from across the country will come together to debate the key issues affecting the profession. It's quite likely that this is going to be a big issue at that event, isn't it?
Yeah, I think it will be. GPs are upset, as we've been talking about, and frankly, I think just baffled at the government's approach. We've talked a bit already about some of the things that Wes Streeting has said, either in the run-up to forming a government or afterwards. And he wrote an opinion piece for us a few days after the general election. And in that, he said that he was determined to address the decline in GP funding, solve the challenges facing general practice, make it a place where new doctors want to work. He actually said the cavalry was coming, but GPs probably now feel a bit more like the cavalry's run them over. The agenda for these conferences is made up of motions that are submitted probably a couple of months in advance. So there's nothing specific on the agenda about the budget at this stage, although it's still likely to be debated in some form because you can put in emergency motions and so on. But the anger in general practice about the budget really changes the mood music around what's probably one of the biggest, most important motions that they're scheduled to debate this year. And that motion calls on the BMA GP committee to ballot the profession for more significant industrial action. Given GP leaders, as we've discussed, see the cost implications of the budget as absolutely an existential threat to GP practices, likely to force practice to hand back their contracts, potentially cut services, cut staff. I think there's a really strong chance LMCs are going to come out in support of this motion. That would mean that just a few weeks after Wes Streeting stood up at the RCGP conference and asked GPs to stop the collective action that they're currently involved in, we could be looking down the line at GPs deciding to step up action. That could ultimately mean even strikes. And one of the motions that did make it onto the agenda also, I think, reflects the mood in general practice and a sense of real concern about the future of the partnership model. There's a motion from Avon LMC that says core GP funding will never be restored to the levels required for a thriving partnership, and that GPs should take steps to protect the salaried GP contract in England in preparation for a fully salaried GP service. So, obviously, let's see how LMCs vote on that. But again, the worries about funding from the budget won't have helped now how GPs are feeling on the future viability of partnerships.
I think that's a good point, isn't it, as well, about this concern. The government has really dragged its feet about coming out and saying whether practices are going to get any support to cover these costs. If you're a practice out there and you've got a vacancy, you're about to hire someone, you're looking for a new partner, all of those things, these are things that practices are not going to really be able to progress on until they've got a bit more certainty about how much money they're going to have from April. I can imagine many practices might be thinking, well, we're just going to have to hold off replacing that nurse for now until we know exactly what money we've got to play with. Or, there's people might be thinking about becoming a partner, might be going, well, I don't think I'm going to do that at the minute until I know exactly how that's going to shake out next year in terms of the money I'm earning. I really think that those two motions are going to be two of the critical things that will be discussed next week.
Yeah, no, I think you're right. And I think it's interesting as well that one of the things Wes Streeting said a little while ago when he asked GPs to stop collective action was that he could understand why the profession wanted to give the last government a kicking, but he didn't understand why they wanted to give the current government a kicking. But now he's given them a big reason why they would want to give the current government a kicking with the budget and, like you just said, the uncertainty about the huge financial cost that it could have for GPs in the coming months.
Yeah, definitely. We may as well just talk a little bit more about the LMC's conference as well here. So as Nick mentioned, the LMC's conference is where GP leaders from local medical committees, they meet to debate and vote on a range of issues. And then those votes, they help inform BMA policy on those issues, including what the BMA's GP committee will be pushing for in contract negotiations with the government. So we've mentioned those two kind of quite critical motions. There are also some other interesting motions up for debate. One that I think will be quite interesting is a discussion about integrated neighbourhood teams. We know the government wants to move towards creating a neighbourhood NHS, and this motion is really going to argue that general practice needs to be at the heart of that model, and these new teams that integrated care boards across the country are going to be trying to get off the ground, that general practice needs to be at the heart of them. Delegates will discuss whether or not community services such as health visitors, midwives and district nurses should be based around GP practices as opposed to bigger organisations they are at the minute. And I guess that's the way they were done in the old days. But they're also going to vote on whether the BMA should be pushing for community nursing staff and all of the funding that goes with that, whether they should all be moved into general practice. So I think if that gets voted through, it'd be really interesting to see how the BMA pushes forward with that kind of idea. Perhaps unsurprisingly, the LMCs are also going to be discussing the GP jobs crisis. We're going to talk a little bit more about that in a minute, but the motion relating to that is calling for financial support for practices so they can afford to employ more GPs, and condemning all organisations that effectively replace GPs with, quote, less qualified alternatives. And in a similar vein, the conference will discuss the GP jobs that have been added to the additional roles reimbursement scheme, which we talked about a couple of weeks ago. They're going to say that the ARRS has worsened the GP jobs crisis, that the GP roles that have been created under the scheme should be open to all GPs rather than just those who've qualified in the past 2 years, and that all ARRS money should be moved into the core GP contract so practices can employ GPs in the way that they want to. All of that is likely to be carried. We know it's already BMA policy to push for that ARRS funding to be moved into core funding. And I think that will probably get a lot of support again this year, particularly given how acute the jobs crisis has become in some parts of the country. So we will be reporting from the conference next Friday, so do keep an eye out on GP Online for all the news from that event next week. And I'm sure we'll be discussing some of the results of these votes on our next news podcast in 2 weeks' time, in particular what GPs had to say about industrial action. Next up, we've discussed the GP jobs shortage a lot on the podcast this year, but we recently published a story suggesting that the huge competition for GP jobs is possibly driving down rates of pay. Nick, you wrote this. Where has this story come from and what exactly is going on?
This just came from a BMA update for sessional GPs. And the update said that the jobs crisis in general practice, so this is the fact that thousands of GPs are currently unable to find work or find enough work, has started to drive down the rates of pay sessional GPs are being offered to work in general practice. We've written stories about the shocking impact of the jobs crisis as a whole. GPs using food banks, a GP working for Uber, a registrar applying to work in Tesco, another GP on universal credit, and so on. I mean, and these are all stories that are unimaginable a few years ago. Just as it would be unimaginable to think that there'd be thousands of GPs qualified in this country and unable to find work in general practice. The issue was always about the GP shortage. But the Sessional GPs Committee says that the rates GPs are being offered have actually started to fall across a range of different settings, so presumably across out of hours, GP practices and other roles that GPs can work in. And at the moment, we're starting to see newly qualified GPs being offered jobs through the Additional Roles Reimbursement Scheme, which you just touched on. Because those jobs aren't open to GPs who qualified more than 2 years ago, the BMA is warning that for GPs who aren't eligible for those jobs, the jobs crisis, the unemployment crisis in general practice is still very much a real issue. And these reductions in rates of pay on offer risk pushing more and more doctors to seek work elsewhere ultimately, whether that's outside general practice or outside the UK altogether.
You recently did some analysis of salaried GP pay for our sister website, GP Business, from the GP earnings and expenses data that was published earlier this year. Those figures only go up to 2022-23, but what did you find from that?
Yeah, so like you said, this was a look at the figures NHS Digital publishes on GP earnings and expenses each year. We talked a while back about how pay for GP partners had gone down by 17% in real terms in the year to 2022-23, and that's all part of this same set of figures. And we talked about how, that loss for partners reflected the loss of extra income for delivering hundreds of millions of COVID jabs over the previous 2 years during the pandemic. The figures actually also show that salaried GP pay went down too in real terms, although not as sharply as it did for partners. There's something you have to bear in mind when you look at these figures. I mean, they're based on tax returns. They don't differentiate between NHS and non-NHS income, so from source of income that GPs might have from work that isn't to do with general practice or isn't to do with NHS general practice. They don't reflect how many hours someone is working to earn the income their tax return shows. So a fall in the headline figure for income could reflect something like GPs generally choosing to work fewer hours after a tough period during the pandemic, for example. It could also reflect the jobs crisis. Does it reflect the fact that as COVID income dried up and practices were seeing their profits drop and their income drop, they were forced to shed staff or not fill vacancies, for example? The amount of work available to salaried GPs, therefore, might have reduced. Anyway, what these figures showed was that salaried GP income before tax fell by around 7% in England in 2022-23 in real terms, despite a slight increase in cash terms. And that GP business piece that you mentioned also looks at how the picture varies across the UK and across regions in England. So for anyone who's interested in a bit more detail, go and look that article up.
Our good news story this week is about patient satisfaction with general practice that's based on data from an ONS survey. We actually spoke about some of this data a few weeks ago on the podcast for our good news slot, but the latest results show even more positive signs for general practice. Nick, what did they have to say?
NHS England's Director of Primary and Community Care, she's a GP, Amanda Doyle, mentioned a few weeks back that there were signs of real improvement in how easy patients were finding it to contact their GP practice. And I think she called these figures green shoots of hope for general practice at the time. After a period of time when GPs have faced huge criticism over access, problems getting through to them on the phone, all of this is really welcome news. And these figures are from a survey by the Office for National Statistics. And there's now a third wave of data, which is one more than we had when we last spoke about this. And basically, each wave includes responses from around about 50,000 people who've contacted their GP practice recently. And what the figures show is that there's been quite a sharp increase in not only how easy patients find it to contact their GP practice, but also in how satisfied patients are with their overall experience of a GP practice. So on the overall rating, about 73% of patients said they had a good overall experience of their GP practice in the latest wave of data. So that's for mid-September to mid-October. And that's up by 5 percentage points compared with the first wave, which was July to August. And 70% of patients in the latest wave said they found it easy to contact their GP practice, and that's up by 10 percentage points compared with the July-August findings. It's another really positive, rapid upward trend. Ultimately, these are good signs for general practice that despite all the pressure that the profession is under, the experience that patients are having of the service is actually getting better as far as these measures would show.
Well, that's it for this week. Thanks so much for listening, and thanks to Nick. I'll be back next week, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice and access lots of other resources and information on our website at GPonline.com.